Evaluation and adaptation.
Welcome. This module is intended for managers of the Antiretroviral Treatment and Access to Service Program, ARTAS. This is the final self-paced mini-module and focuses on evaluation and adaptation of ARTAS. It lasts approximately 20 minutes, and we want to remind you that this event does not replace a formal ARTAS training. If you would like to participate in a formal training, we will provide you with the links at the end of this session for you to request it and to access the pre-course module. We also want to highlight that this presentation is the result of a collaborative effort of 4 capacity building assistance providers, members of the CEBA Provider Network. That is myself, B.A. Laris from ETR Associates, Armand Loers with JSI Research and Training Institute, Melanie Graham from the New York Department of Health, and Sarah Jane Rath from Proceed.
ARTAS for managers.
As you know, by this point in the process, we have designed this series to support you and other supervisors and managers who oversee programs that are implementing ARTAS as part of their CDC-funded initiative for high-impact prevention. This is a 3-part series that included first a live webinar, second, a series of 4 self-paced mini-modules to provide more detailed information on key components necessary to support the successful implementation of ARTAS, this module being one of them, and finally a live technical assistance session where you will have access to a panel of skilled capacity building providers to answer questions and help troubleshoot any issues or concerns.
3-part process.
During this presentation, we want to encourage you to take notes, as well as to type the questions you might have on the pod that appears on the right side of your screen. These will be recorded, and we will address your questions during the live technical assistance session.
Man in Superman shirt. Text, what is my role?
As a manager, you're probably wondering what your role is with ARTAS. We like to think of this in a few stages. The getting started stage, or what to consider when becoming familiar with ARTAS and when deciding to implement the intervention. The pre-implementation phase, where the agency makes any necessary changes, plans for the human and monetary resources, builds relationships with community partners, creates a marketing plan, and develops a monitoring and evaluation plan. The implementation phase, where issues that the implementing agency staff will focus on while implementing ARTAS, and the maintenance phase, which is integrating ARTAS into existing services, continuous work to adapt, monitor, and evaluate the intervention, as well as to make any necessary changes. This is laid out in great detail in the ARTAS Implementation Manual, which is available for you to download at the end of this module.
Text, maintenance.
As we mentioned, there are lots of details in the ARTAS Implementation Guide, but today we're going to highlight a few key ideas that we think will be the most helpful for you in the maintenance phase of ARTAS.
ARTAS monitoring and evaluation.
So today we'll be covering the monitoring and evaluation and adaptation for ARTAS. And after you complete this module, you'll be able to formulate the key questions to ask about your ARTAS program to meet your goals and objectives. You'll be able to select the relevant ARTAS activities to monitor and evaluate in order to be able to know if the program is working as you planned. You'll also know the important factors to consider when deciding if you need to adapt ARTAS for your specific population. So let's begin.
Chain links. ARTAS goal.
The goal of ARTAS is to assist persons who have been recently diagnosed with HIV getting linked to care for the first time. ARTAS can also help persons living with HIV re-enter care after a prolonged absence. ARTAS is a multi-session approach that focuses on the needs of each client individually. It is important for you as a manager to understand the goal of the approach as well as its process and structure in order to be able to effectively support your linkage coordinators and their efforts.
Monitoring and evaluation.
So when we think about ARTAS monitoring and evaluation, we really realize that there are 3 big reasons to implement a monitoring and evaluation process for your ARTAS program. We're going to talk about each of these in more detail. They are documenting the implementation process, looking at program improvement, and making sure that you have information for accountability.
Documenting the process.
The first one is documenting the implementation process, and because we're about to share some important information, I want to remind you to type the comments and questions you might have during this presentation down on the notes pod to the bottom right of your screen. It will help us address your concerns more effectively. Now, going back and related to ARTAS, documenting the implementation process includes keeping a record of how the activities that take place during the implementation are being performed. It also involves describing the challenges encountered during this process, as well as the approaches used to resolve these challenges.
Program involvement.
Now, program improvement. As the intervention is implemented, it's important to identify the strengths and the weaknesses of the program and use that information to improve the program. Monitoring also helps agencies to compare actual outcomes to target outcomes such as number of people enrolled, number of sessions conducted, number of clients referred to medical care.
Accountability.
Accountability. Accountability refers to being accountable at the agency and staff level to funders, clients, board of directors, and any other people involved. Staff need to show evidence of program progress to supervisors and clients, supervisors to agency administrators, and administrators to funders and board of directors. The information gathered through monitoring and evaluation activities should be used to help you fine-tune the intervention delivery by addressing areas where problems in the implementation plan were encountered.
Process monitoring and evaluation.
So as you think about your process monitoring and evaluation, there are several actions you can take to benefit the organization through the evaluation of your ARTAS program. Specifically, you can identify the questions you want to answer about your ARTAS program. You can select the ARTAS elements to measure. You can verify the tools needed to capture ARTAS information, develop processes to review collected ARTAS data, examine trends to make adjustments to your ARTAS programs. So we're going to go ahead and provide more detail on what each of these actions entail.
Monitoring questions.
Now, identify the questions you want to answer about your ARTAS program. The four most common monitoring questions many ARTAS programs use are: did we follow the ARTAS protocol during the intervention delivery? Did we enroll the number of clients we intended into ARTAS? Did we enroll the types of clients we intended into ARTAS? Did the clients who were enrolled in ARTAS attend their first medical care appointment?
Elements to measure.
And once you have selected the questions of interest related to your program goals and objectives, you can also identify which are the most important aspects of ARTAS to focus on. And the four most common elements to measure are the number of ARTAS activities delivered as designed, also the number of clients who are enrolled, and as well as the demographic of clients. That includes the age, the time since diagnosis, antiretroviral treatment history, previous case management or social services received, and previous HIV care, etc. And now it is important to highlight that the only required outcome evaluation element is the number of clients linked to medical care.
Outcome indicator.
If you take a look at this session notes summary form, this is a sample form from the implementation manual. It can help you keep track if clients are linked to medical care, and you can also use this form as is, or you can adapt it to better meet your needs. You may also just want to take some of these ideas to incorporate into other forms you are already using within your agency.
Session notes summary.
Also, if you take a look at these performance form,
Performance process indicator form.
this one. If you take a look at this performance process form, this is a sample also from the implementation manual, and it can help you keep track of scheduled appointments, emergency appointments, and the need to reschedule or no show-ups, and also complete appointments, plus any brief notations or barriers or any comments that you may want to make. You can also use this form as is, or you can also adapt it to better meet your needs. You may also just want to take some of these ideas to incorporate into any of the forms that you're already using within your agency, and these are simply some ideas and suggestions that have been developed for you if you find it helpful based on your program design.
Fidelity assessment quarterly report.
Third, you also may want to take a look at this summary form. This is a weekly or monthly tallies that can then simply be combined in a quarterly report format. Again, feel free to use this or adapt it or incorporate it into your own agency forms. These are resources available for you to use as you need it.
Tools to use.
We also want to remind you that these forms that we are presenting are in your implementation manual and will also be available for you to download at the end of this presentation.
Tools to use. Simplified tracking.
The ARTAS program provides you with built-in tools and forms that can be easily used to monitor and measure the key elements of your program. Training your linkage coordinators to accurately use and complete these forms will make it easy for you to be able to track your progress and success. As Armand just mentioned, these forms can be used as is or adapted and incorporated into current forms your agency already uses. ARTAS forms often used for monitoring and evaluation include the following: session activity forms, participant eligibility and agreement form, session activity form summary, ARTAS monitoring worksheet, ARTAS performance process indicator form, ARTAS fidelity assessment quarterly report template. And these can be downloaded here or also found at effectiveinterventions.cdc.gov.
Review the data. Highlight success. Plan for the future.
So now we want to think about, once you've collected this data, how we review this data. Reviewing your data can be a very powerful tool. Process evaluation involves comparing the process monitoring data to what was planned. The results of this comparison can inform future program planning as well as demonstrate areas of success. Some possible questions that you might want to think about are: was each core element addressed? Were any of the ARTAS key characteristics changed? Which key characteristics were changed? Was the intended focus population recruited or enrolled? What recruitment? Were the intended numbers of clients enrolled? Were sessions held in a convenient place for clients? What challenges were faced in recruiting clients? What challenges were faced during the session? And what was the feedback from participating clients?
Find patterns.
A key role you can play with monitoring and evaluation is to look at trends in the data and identify ways to continuously improve the approaches and systems based on the data. Establishing a standard cycle for reviewing and discussing data will help build a climate of reflection and quality to support the outcomes of the clients and ensure that the program are meeting its goals and objectives. This is another area where CBER providers can help you think about simple systems to use and support quality improvement and sharing data to make recommendations that are going to help you make mid-course corrections as needed in your programs. Remember, you can access free capacity building assistance from any of the members in the CBER provider network. And the link is provided at the end of this webinar.
Adaptation of ARTAS pyramid.
ARTAS is an evidence-based intervention. It has been proven effective as designed and should be implemented with fidelity to ensure the best results. There may be certain situations when an agency is interested in making changes to ARTAS. Typically, these situations are related to increasing the effectiveness of ARTAS by reducing the burden on staff or clients in special circumstances. Before any adaptations, it is strongly recommended that the agency try implementing ARTAS as designed initially. It is also required that agencies consult capacity building providers to support any adaptations.
Agency needs.
Certain adaptations may be considered to reduce the burden on staff and clients without altering the core elements. Often this is related to challenges or limitations specific to the agency. For example, this might be an agency in a remote or rural region or in a very resource-limited area. These adaptations would make it more feasible for you to successfully implement ARTAS with fidelity to the core elements. Here are a few examples. Changing the length of time linkage coordinators can work with clients. Partner with other agencies for meeting space. Provide transportation or transportation vouchers. Create a linkage coordinator on-call system. Conduct enrollment sessions via phone. Conduct enrollment sessions when giving positive HIV test results.
Client needs.
ARTAS is a strengths-based intervention. This is a foundational belief in the importance of meeting the client where they are at. Depending on the client or population served, these adaptations would make it more feasible for an agency to successfully reach clients while still maintaining fidelity to the core elements. Here are a few examples. Increasing the time from diagnosis, increase the length of time working with the client, change or eliminate age or sex requirements, subcontract client recruitment to outreach workers or ASOs, provide incentives, adapt language for trans or Native American populations.
Adapting ARTAS.
We have shared several examples of some adaptations that can occur within ARTAS. Remember that with any adaptation, the changes must make the program even stronger. Also enhance the delivery of the intervention, make the information more accessible for clients, and give the agency a chance to be creative with the intervention. If you are considering any adaptations, type them in the notes pod, and we can provide advice and share lessons learned with you in our next session. In this module, we have covered the essential elements you need to know and to keep in mind for the successful implementation of ARTAS in the maintenance phase. These include thinking about monitoring and evaluation for program improvement, accountability, and reporting, as well as considerations for adaptation. This has been your introduction. Remember that capacity building assistance is available for you in any of these areas. We are committed to supporting your ARTAS program.
ARTAS Live TA Session.
You have now completed the 4 mini-modules of ARTAS for Managers. We hope that this has provided you with a strong foundation to provide management and oversight to your ARTAS program.
Files to download.
During the next component of this series, we are offering a live technical assistance session. We will discuss any questions or issues that have arisen through your ARTAS pre-implementation, planning, and implementation process, and all of the questions that all of the managers have submitted during the 4 mini-modules. Many organizations are at different levels of comfort with the implementation of their ARTAS programs. Some organizations have raised concerns related to recruitment and retention and integration with other programs like navigation and referral to other high-impact prevention-related services. During the live TA session, we will share insights from capacity building specialists as well as from you and other managers implementing ARTAS across different regions. This will be an exciting learning opportunity for all of us to share our experiences, and we look forward to exploring these ideas with you soon. To complete your CEU documentation, please click the link to the left of your screen to answer 2 questions to make sure that you get your CEUs. Please note that in the Files to Download pod on the top of your screen, you have all of the documents we've discussed during all 4 mini-modules, which you are able to download at any time, as well as the pod with resources. And if you are interested in clicking to the Effective Interventions website directly to access materials, as well as to sign up for an ARTAS course. And then if you would like to request capacity building assistance, you can go ahead and just click the live link there in the resources, which will take you directly to that link. Again, we thank you for your participation, and we look forward to hearing from you on the live session.